We continue learning about nervous system, and this looks like first part of peripheral nervous system. Today topic is eye, organ of vision. In Latin, organon visus. Eye in Latin, ophthalmos. Oculus. So eye consists of, this part is eyeball, in Latin bulbus oculi, and auxiliary apparatus of eye, accessory apparatus. Eyeball consists of 3 shells and nucleus. What are shells? First shell is fibrous shell, tunica fibrosa oculi. Consists of sclera, larger part, and cornea, transparent, in front. Between sclera and cornea, here is groove, sulcus sclerae. In sclera, close to the groove, there are vein, named sinus venosus sclerae, or Schlem's canal. Second part is vessel tunic, tunica vasculosa. Behind this and behind this is choroid itself, choroida. Then second part, this is ciliar body, corpus ciliare, consists of orbiculus ciliaris and processus ciliaris. In the thickness of this annular part, orbiculus ciliaris, there is muscle, musculus ciliaris. Musculus ciliaris, this is muscle for accommodation. Further, closer. Musculus ciliaris attached to the lens. Between musculus and lens, there is ligament, zonula ciliaris. Second name, Zins ligament. And processus ciliaris produce fluid inside eye. So, choroida, corpus ciliare, and this part is iris, in Latin iris. Iris is vertical plate, so it has facies anterior, facies posterior. In the center hole is pupil, in Latin pupilla. Two border. This border is margo ciliaris, this border is marga papillaris. In the thickness of iris, there is 2 muscles, musculus sphincter pupillae and musculus dilatator pupillae. These 2 muscles to regulate amount of light pass through the pupilla, not accommodation. Next part. Inside is third shell. Third shell is retina. Retina has 2 parts. In front part, non-visual part of retina, blind part, pars ceca retina. Behind is visual part, pars optica retina. Also, retina has 2 sublayers. Between these 2 parts is like jagged alliance, ora serrata, jagged edge, ora serrata. 2 sublayer of retina. Inside, closer to the center, is neural layer with neural cells. Outer, farther from center, is pigment layer. So, in pigment layer we have receptor for light. Rods and cones. Rods for darkened light. So this is for twilight vision. Cones for color. So this is daylight vision. So light should pass through the pupilla, then pass through the neural layer, then to the pigment layer. Okay? So pigment layer is outer in retina. Also in the retina, medially we have exit of nerve fibers and form disc. Then is nerve, nervus opticus. So this is discus nervi optici. So there is no receptors. So this is blind spot. Laterally is yellow spot, macula. In English and in Latin, macula. Also in Latin, second name macula lutea, yellow spot. In the center of macula, this is fossa. This is center of best vision. Only cones there. Next is what is in the center of eye. So these are three shells. Then in the center is nucleus. Nucleus consists of behind in the center is corpus vitreus, vitreous body. This is like jelly. In front of corpus vitreus is fossa, fossa hyalinoidea, for lens. Lens is second part of nucleus. This is biconvex lens covered with capsule, capsula lentis. To the capsula attach Zins ligament. In front of lens we have two chamber, two space. Behind iris we have posterior chamber, camera posterior. In front, between iris and cornea, we have anterior, camera anterior. Now, aqueous humorous, fluid inside eye produced in the processes of ciliary body. Then, between processes and between fibers, it passed through the posterior chamber. This space between fibers named Petit's canals. So, then posterior chamber, then pupilla, then anterior chamber. After anterior chamber, we have angle between iris and cornea. So this angle is here, close to the groove. This is iridocorneal angle, or Fontaine space. Then it goes to the sinus venosus sclerae, Schlem's canal. This is outflow of aqueous humorous. This is structure of eye. Next part is axillary apparatus of eye. So we have, the first part is muscle. We have two oblique muscle, musculus obliquus superior, musculus obliquus inferior, and four direct muscle. Musculus rectus inferior, musculus rectus medialis, musculus rectus superior, musculus rectus lateralis. All muscle except inferior start from tendon around the nerve and goes to the eyeball. Inferior start from bones, from orbit. You should know innervation of this muscle. So, musculus obliquus superior at first goes to the trochlea, then to the eyeball. So, trochlea, so innervation of obliquus superior, nervus trachearis. This is number 4 cranial nerve. Musculus obliquus, musculus rectus lateralis. Rectus lateralis pull eye to the side. To the side, in Latin, abducens. So, innervation of musculus rectus lateralis is nervus abducens, number 6 cranial nerve. Other muscle innervates by number 3 cranial nerve, nervus oculomotorius. So, what muscles innervates by nervus oculomotorius? Rectus superior, rectus medialis, rectus inferior, obliquus inferior. Behind eyeball we have fat tissue that form capsula adiposa. Between capsula adiposa and eyeball there is fibrous layer separates these two parts. Tenon's capsule. Next, in front of eyeball we have two eyelids. So we have upper and lower eyelid. Palpebra superior, palpebra inferior in Latin. Second name, palpebra, Greek name, blepharon. So formation blepharitis. Outside of eyelid is skin. inside ear tunica conjunctiva. On the edge there is cilia, eyelashes. So above is eyebrow. Because of this, eyebrow in Latin supercilii. Here is cilia, above supercilii. So outside skin, inside conjunctiva. In the thickness of eyelid there is cartilage named tarsus. And there are a lot of glands that produce sebum. Glands, another name, meibomian glands. Inflammation, meibomyitis. And for upper eyelid we have muscle, musculus levator palpebrae superioris, not for lower. Between two eyelids we have slit, rima palpebrarum. In the medial angle, let's go there. In medial angle here we have looks like lake, lacus lacrimalis, and in the center part of meat, caruncula lacrimalis. Now lacrimal apparatus of eye. Here is gland, glandula lacrimalis. Do you remember innervation? Let's repeat. So, glandula lacrimalis, this is alveolar tubular gland in lateral angle of orbit. Opens to below upper eyelid. Then ears go to the rima palpebrarum. Rima palpebrarum and form stream, rivus lacrimalis. Goes to the lake, lacus lacrimalis. There is a little pinhole opening, punctum lacrimalis, leads to the little canal, canaliculi lacrimalis, leads to the sac, saccus lacrimalis, and sac opens to the canalis nasolacrimalis, leads to the meatus nasalis inferior. Eyelid covered with outside skin, inside conjunctiva. Conjunctiva is tunica conjunctiva. Tunica conjunctiva covers eyelid inside and sclera till cornea. So we have pars palpebrarum conjunctiva and pars bulbaris conjunctiva for bulbus oculi. And between them is fornix. So we have fornix superior and fornix inferior. So lacrimal gland opens to the fornix superior, lateral part. Conjunctiva, muscles, and tract. Yes, tract. So, last part is optic tract. Optic tract is actually optic nerve, second cranial nerve. So, characteristic. This is ascending, goes to the brain, partially crossed, sensory, and 4 neurons. Rods and cones are sensors, receptors, not neuron. So, after pigment layer of retina, receptors attached to the bipolar cells placed in the neural layer of retina. So first neuron is bipolar cells. Then goes to the ganglion cells, again to the retina, again in neural layer of retina. So retina has 2 neurons, first and second. Then neuron, it's not posterior part, this posterior part. Then neuron form optic nerve. Optic nerve pass to the discus nervi optici, then goes to the canalis opticus. In orbit, canalis opticus leads inside skull. Canalis opticus. After canalis opticus, here we have cross, chiasma optici. Chiasma optici is cross, but not full, only medial crossed, lateral uncrossed fibers. After cross, it's stop nerve, then start tract, optic tract. Optic tract goes to the third neuron. Third neuron, this is subcortical center of vision. This is lateral geniculate body, upper collicles, and pulvinar, part of thalamus. After third neuron, it goes to the capsula interna, posterior part of posterior leg of capsula interna. Then goes to the gyrus and form radiatio optica. Fourth neuron is cortical center of vision. This is sulcus calcarinus, medial surface occipital wall. Sulcus calcarinus. That's all. Yes? So, if muscle tenses, it makes bigger. Yes? So, ligaments closer to the lens relax and makes thicker.
Connects.
Yes. If muscle relax, it makes flat and strength. So lens make thinner. Okay? Opposite. Next topic is ear. Ear in Latin auris. Or you can say organ of hearing, organum auris. So, organ of ear, auris consists of external, middle, and internal ear, three parts. External ear is auricula and meatus acousticus externus. Auricula is cartilage covered with skin. Structures: helix, antihelix, tragus, antitragus. This part is lobe of auricula, lobulus auriculae. Auricula for concentrate audio waves that goes to the meatus acousticus externus. This is cartilage part, and then we have bone part. In the end of bone part, we have membrane, membrana tympani. So, porus acousticus, meatus acousticus externus is blind. Membrane set in groove. Inside temporal bone, we have groove, sulcus tympani, sulcus membrana tympani. Membrana is not only fibrous. It has fibrous fibers, but upper part is soft, not tangent part. This is pars flaccida or shrapnel membrane. Lower part, larger, is tangent part. In the center is umbo, like navel. Porus acousticus externus has glands that produce cerumen. Next part is middle ear. Auris media. Auris media is space, so this is cavity, tympanic cavity, cavum tympani. With auditory tube goes in front, and cavity inside mastoid process. So there are cells of mastoid process. So tympanic cavity. It has three floors. Border is upper and lower end of tympanic membrane. So three floors is epitympanum, mesotympanum, hypotympanum. And upper floor has second name attic. Because of this is cavity, it also has 6 walls: medial, lateral, upper, lower, in front, behind. So here is tympanic membrane, lateral wall is paries tympanica. Medially, inner ear named labyrinth. So medial wall is paries labyrinthicus. In front we have carotid artery. Anterior wall is paries caroticus. Behind we have mastoid process. Posterior wall is paries mastoideus. Above we have tegmen tympani, paries tegmentalis, upper wall. Below we have jugular vein here, paries jugularis. So on lateral wall we have tympanic membrane. What is on the medial wall? On the medial wall we have This is lateral wall. This is medial wall. On the medial wall we have two opening window. Above is vestibular window. It closed with bone. Below is cochlear window. Cochlear window closed with membrane. This is second membrane, so name is membrana tympanica secundaria. This is like first, this is secondary. And below little cave promontorium. That was medial wall. Now, in front, anterior wall pars caroticus. Here we have exit to the auditory tube. Tuba auditiva. What is auditory tube? This is part of muscular tuberal canal. This is muscular tuberal canal. This is canal for carotid artery, canalis caroticus. Muscular tuberal canal consists of two half canal. Upper part is there on the desk for muscle.
Musculus tensor tympani.
Yes. This is musculus tensor tympani. So, canal semicanalis musculi tensoris tympani. Below is auditory tube. So, semicanalis tuba auditiva. First part is bone part. Then we go to the nasopharynx. So, there is cartilage part. Between them is narrowest part, isthmus. So, tuba auditiva has two parts, bone and cartilage part. This is for connection with external environment. So, here is atmospheric pressure. Posterior wall. Posterior wall has pyramidal extension for musculus stapedius, and enter to the mastoid process. So, antrum mastoidum enter named additus ad antrum. Upper wall has only name, lower wall only name. I already said about medial wall. That's all about walls. So, what is inside? Inside tympanic membrane we have three little bones. We have malleolus attached to the membrane. Between two bones we have incus, and then we have stapes. To the malleolus we have attached musculus tensor tympani to make membrane tension, to strengthen membrane. To the stapes we have attached musculus stapedius, stapedius. So this is against tensor tympani, so relaxes membrane. What is the function of these three bones? Function: sound wave goes to the membrana tympani, transition to the mechanical waves. So bones for passing through mechanical waves after audio waves. Also, because of this is bones, it also can give us bone conduction. If something attached to the bone, we can hear it like sound, because pass through the bones we can hear it, this vibration. So, two function: mechanical transition of audio waves and bone conduction. Between bones we have full joint, articulatio. Name from incus. Articulatio incudo malleolaris, articulatio incuda stapedialis. After this, between stapes and the next part, this is syndesmosis. Syndesmosis, this part is vestibulum, syndesmosis stapedio vestibularis. And I already said about it. So, if we learn about it next class, but if you want to know, this musculus tensor tympani innervates by cranial nerve number 5, trigeminal nerve. And this innervates stapedius from cranial nerve number 7, facial nerve. So different innervation. Middle ear, that's all. So next part is inner ear. So here is labyrinth. So inner ear is labyrinth. But labyrinth consists of bone labyrinth And inside bone labyrinth, we have membrane labyrinth. Membrane labyrinth, the same shape, almost the same shape, like bone labyrinth. So this looks like bone labyrinth. It's not full shape, okay? So we have middle part is vestibulum with two window, vestibular and cochlear. Fenestra vestibuli, fenestra cochlea on lateral wall. For inner ear, this is lateral wall. Then behind we have semicircular canals. We have three semicircular canals, anterior, posterior, and lateral. And every canal has two legs, but two legs in one case you need in one, so this is common leg. Then every canal has ampular extended leg, and one canal has separated simple leg, so opening only 5. 3 canal, but 5 opening to the vestibulum. In the vestibulum also we have 2 depression, elliptical pocket and sacculus, round pocket. Between them is crest. In front of vestibulum we have like snail, cochlea. What is cochlea? So in front cochlea. This is semicanals here. Not show it bone labyrinth, only membrane labyrinth, but the same shape. And this is cochlea. And this is bone labyrinth, bone part. So do you see? This is bone part of semicanals. Between them is vestibulum, cannot see. And this is cochlea. What is cochlea? In the center we have stem, rod, mediolus. This is mediolus. Around mediolus, bone goes and make 2.5 turns. This is canal, then turn behind and form. This is canal, second turn. And this is half turn. From road we have plate, lamina spiralis acei, that divided on 2, but not fully. Lamina doesn't attach to the opposite wall, so it's not closed. Bone labyrinth is not closed. Only membrane labyrinth, full closed, these 2 parts. Mediolus. So, inside bone labyrinth, we have membrane labyrinth. So, this is membrane labyrinth. And again, in the middle part, we have sacculus and utriculus placed in pockets. So, it placed both in vestibulum. Behind is 3 semicanals placed in bone semicanals with the same legs. 1 common, 3 ampular, 1 simple. And in front is cochlea. Cochlea consists of 3 walls. 3 walls start from lamina spiralis acei, goes to the opposite side, goes up and external. So, in cut it's triangle in shape. And on the basilar wall, we have organ of Corti, or spiral organ, for hearing. So, cochlea for hearing, okay? On the Corti of organ, we have only sensors. Then, on the rod and in the lamina spiralis acei, we have first neuron. All neurons together named ganglion spirale. So, all cells, neuron here, named ganglion spirale. In the canals, we don't have ganglion cells. We have only receptors. This organ for vestibulum, to balance. Axons go to the porus acousticus internus, and inside porus acousticus internus we have ganglion vestibulare. This is difference. In cochlea we have ganglion spirale for hearing. Here we have ganglion vestibulare. So, what is the pathway of sound? At first, auricula concentrate waves. Then it goes to the porus acousticus externus, till membrane. Membrane transition to the mechanical waves. It passes through the malleolus, incus, stapes, goes to the fenestra vestibuli, vestibular window, goes to the canal. Because plate divided canals on the two, at first it goes to the vestibular scale, goes to the top. There we have connection between two parts. This is opening, helicotrema. Then goes back to the second scale, cochlear scale, and goes back to the second window, cochlear window. Cochlear window is closed. So because fluid vibration, sensory cells gives neural electrical impulse. And what is fluid inside? So, membrane labyrinth, inside bone labyrinth. Between membrane and bone we have perilymph. Inside membrane labyrinth we have endolymph. So, all of this gives us nerve number 8, vestibulocochlear nerve. In front, cochlea for hearing, this is cochlear part. Behind, for balance, this is vestibular part. Inside cochlea we have spiral ganglion. Inside semispiral canal, semicircular canal, we don't have ganglion. Ganglion is in porus acousticus internus. Both nerve form nervus vestibulocochlearis. We will learn it on the next class. And here, so this is pyramid, porus acousticus externus, then here, porus acousticus internus. Okay? Porus acousticus internus.
Internus.
Good. Porus acousticus externus. Externus. Foramen stylomastoidum.
Foramen
Where is processus related?
Foramen stylomastoideus. Stylomastoideus.
ಇಲ್ಲಿ ಮಾಸ್ಟರ್ ಐತೆ ಇಲ್ಲಿ ಸ್ಟೈಲೈಟ್ ಪ್ರೊಸೆಸ್ ಬರುತ್ತೆ ಮಧ್ಯದಲ್ಲಿ ನೋಡಿ ಅಲ್ಲಲ್ಲ ಇಲ್ಲಿ
Foramen stylomastoideus.
Good. So, I think you want to learn right now, yes? What is the name of this structure?
ಟೆಗ್ಮೆಂಟ್ ಅಂಡ್
Tegment.
What is the name of upper wall?
Superior.
Superior. Name of superior wall. Parius.
ಪಾರ್ಸ್ ಪೆಟ್ರೋಸ್
Tegmentalis superior.
What is this?
ಕೆರಟೆಡ್
Name of anterior wall.
ಇಂಟೀರಿಯರ್
Anterior wall of tympanic cavity. This is carotid artery. Parius carotid.
ಪಾರ್ಸ್ ಕೆರಟೆಡ್
This is mastoid process.
ಎಸ್
Name of posterior wall.
Mastoideus.
This is tympanic membrane. Lateral wall. Tympanicus. Here should be jugular vein. Lower wall.
ಪಾರ್ಸ್
Jugularis. This is, what is this?
Cavity.
This is cavity.
ವೆಸ್ಟಿಬ್ಯುಲರ್
Vestibular is part of labyrinth. Name of medial wall. Parius.
ಪಾರ್ಸ್ ಲ್ಯಾಬ್ರಿನ್
Labyrinthicus. Okay. Name of this muscle.
ಟೆನ್ಸರ್ ಟಿಂಪಾನಿ ಮಸ್ಕುಲಸ್ ಟೆನ್ಸರ್ ಟಿಂಪಾನಿ
This muscle.
ಮಸ್ಕುಲಸ್ ಸ್ಟೆಪೆಡಿಯಸ್
Stapedius. This bone.
ಮೆಲಿಯರಸ್
Stapes.
What's last?
Stapes.
Stapes. This?
Incus.
Okay. What is the name of this stem?
Triangle.
Modiolus. Modiolus. Okay. Upper scale. Scala
Superior.
from first window. Vestibuli. Lower scale. Scala. Cochlea.
Cochlea.
Okay. This is vestibular opening. Window in Latin. Fenestra. What is this?
Vestibular.
Vestibule. This opening.
Fenestra cochlea.
Fenestra cochlea. Okay. This opening leads to the mastoid process. Name of this opening?
Antrum.
You remember larynx? Aditus ad larynx. This is aditus ad antrum. What is this?
Canalis
Mastoidus. Yes.
musculo
Part of musculotubarius. What name of this?
musculotubarius.
What name of this canal?
Canalis musculotubarius.
Musculotubarius. It's together with two semicanals.
Okay. It's an
Caroticus.
auditive tube. Auditory
Auditory
tube.
tube.
Auditory
Latin?
tube. Tube additive.
Auditive.
Tube additive.
Auditive. Okay. Okay.
By the way,
Peripheral nervous system. We talk about nerves. And we start from cranial nerves. Today we'll talk about first, second, third, fourth, sixth, and eighth. We skip 5 and 7 for next class. First nerve is nervus olfactorius, olfactory nerve. This is for smelling. Ключ? Nervus olfactorius is derivative of brain, so it doesn't have nucleus. Nervus olfactorius, Nervus olfactorius is sensory nerve, smelling, sensory. 3 neuron, ascending, not crossed. So, first, if you talk about sensory, you should start from receptors. Where are receptors? Receptors in nasal cavity in regio olfactoria. Here we have receptors placed in the end of dendrites. So, receptors is part of first neuron. So, in regio olfactoria also placed first neuron, bipolar cells. In the end of dendrite receptors, then axons form 15 to 20 filia, nerve threads that pass through the lamina cribrosa of ethmoid bone and goes to the second neuron. Second neuron placed in bulbus olfactorius. Bulbus olfactorius, here. Here is second neuron. Then goes to the third neuron, form tract, olfactory tract, tractus olfactorius, goes to the third neuron. Here we have trigonum olfactorium, substantia perforata anterior, and septum pellucidum. This is third neuron. And all this structure, third neuron, second neuron, and first neuron, is peripheral part of olfactory tract. Then we go to the central part. Where is central part? Central part is nucleus amygdaloidus, corpus amygdaloidus, and corpora mammillaria. This is subcortical center of smelling. Then goes to the cortical center of smelling, nucleus dentatus and gyrus dentatus and gyrus fornicatus. Gyrus fornicatus, you remember, consists of gyrus cinguli, isthmus, and gyrus parahippocampitis. So that was smelling. Now second nerve. Second is optical tract. So nervus opticus. You know everything about nervus opticus. Receptors placed in retina. That first characteristic. So you should say this is sensory, ascending, for neuron, partially crossed. Receptors, rods and cones in the retina, pigment layer. Then goes to the first neuron. This is bipolar cells in retina in neural layer. Second neuron, ganglion cells again in retina. Then axons form nerve, optic nerve, that goes out to eyeball, pass through the cranial cavity using canalis opticus. After canalis opticus form cross, medial crossed, lateral uncrossed, or partially crossed. Then optic tract goes to the subcortical center of vision, third neuron. This is corpus geniculate laterale, upper collicles, and pulvinar of thalamus. Then goes to the posterior part of posterior leg, capsula interna, form radiatio optica, and goes to the cortical center of vision, sulcus calcarinus. Optic, repeat. Then we have third. Third is oculomotor. Nervus oculomotorius. This is motor. In some sources you will find is mixed. It means it has motor and vegetative. It's not classical definition. Classical definition mixed means sensory and motor. So if you said mixed, you should immediately explain it has motor and vegetative fibers. What does it mean mixed? So, characteristic. Nervus oculomotorius, it's motor or mixed with vegetative. So it has nuclei, 5 nucleus. So and it's descending. If descending, you should start from nucleus. Where is nucleus? In midbrain we have nucleus motorius nervi oculomotorii, motor. Then nucleus nervi oculomotorii, Jakubovich, or, and nucleus centralis impar. Centralis impar means unpaired. In center, in middle position, one nucleus for right and left oculomotor nerves. It goes out of brain between two legs of brain in interpeduncular fossa. You see there, between two legs, above pons between two legs. Then goes to the orbit using fissura orbitalis superior. In orbit it gives two branches, ramus superior, ramus inferior. Ramus superior innervates musculus rectus superior and musculus elevator palpebrae superioris. Ramus inferior innervates other muscles, musculus rectus medialis, musculus rectus inferior, and musculus obliquus inferior. And ramus inferior gives vegetative fibers that goes to the ganglion ciliare, that placed in the orbit behind eyeball. Ganglion ciliare is vegetative ganglion. So fibers switched here, and then fibers goes with other nerve as a part as nervi ciliaris longi. This is part of nervus trigeminus, trigeminal nerve. Goes to the eyeball and innervates musculus sphincter pupillae and musculus ciliaris, non dilatata pupillae. This is part of parasympathetic system. So, nervus olfactorius, part of parasympathetic system. Oculomotor. That's all. So, next. Next is number 4. Nervus trachearis. Trachearis is only motor, so it's descending motor, only one core. In midbrain, nervus trachearis has only one nucleus, nucleus motorius nervi trachearis. It goes out of brain, very specially. Only these nerves goes behind. So it's here, goes behind. All other nerves in front, only this nerve behind. Then it turns in front and goes to the fissura orbitalis superior again. In the orbit, it innervates musculus obliquus superior. Only one muscle, that's all. Very easy. Next, 4, 5 we skip. Then 6, nervus abducens. Nervus abducens, descending motor, only one nucleus. And I forgot to say, it's crossed. So, trochlearis and abducens crossed. And what I will explain about cross a little later. Okay. So, nervus abducens. It has only one nucleus, nucleus motorius nervi obducentis. It placed on upper half of fossa rhomboidea. Upper half of fossa rhomboidea is nucleus motorius nervi obducentis in facial colliculus, colliculus facialis. Around this nucleus we have fibers of facial nerve. It makes elevation, facial colliculum, inside nucleus of number 6. It goes out of brain above pons here, below pons here. Goes in front in fissura orbitalis superior. In the orbit it innervates only one muscle, musculus rectus lateralis. That's all. Next is nervus vestibulocochlearis.
That is eighth one.
Yes. Number 8. So, vestibulocochlearis. Characteristic. It is sensory, so it's ascending. It has 3 neurons and start in labyrinth. So, in labyrinth we have 2 parts. So, this is nerve vestibulocochlearis, but it consists of 2 parts. One is nervus cochlearis, one is nervus vestibularis. So, cochlear part. Inside cochlea we have organ of cortex. These are receptors. Where is neuron? First neuron placed in lamina spiralis osseae and mediolus. So, cells together named ganglion spiralis. This is first neuron. Then axons form nervus cochlearis. It goes inside porus acousticus internus, meatus acousticus internus, and unite with nervus vestibularis and form nervus vestibulocochlearis. What about second part? Second is nervus vestibularis. Here is only receptors. Receptors is in sacculus, in utriculus, and in ampullar legs. There are little stone otoliths. These are receptors. Dendrites goes to the first neuron. First neuron placed in ganglion vestibularis. Ganglion vestibularis placed inside meatus acousticus internus at the bottom. And then it goes like nervus vestibularis. Unite with cochlearis form nervus vestibulocochlearis. Okay? So first neuron here. There is next, second neuron. Where is second neuron? Vestibular and cochlear are little separate, but in one place, in lateral angle of fossa rhomboidea. So first is hearing. So we have dorsal and ventral cochlear nuclei. This for hearing. So this is second neuron of cochlear tract, nervus cochlearis. Then, after second neuron, it goes to the opposite side. So make cross, limniscus lateralis. And then goes to the third neuron. Third neuron is the cortical center of hearing. Inferior collicles and corpus geniculatum mediale. After third neuron, it goes to the cortical center of hearing. It goes to the capsula interna, before posterior part of posterior leg, then forms to the radiatio acoustica and goes to the cortical center. It placed in middle part of superior temporal gyrus, zone of Geschl, area of Geschl. So that was hearing. Now balance. Vestibular nerve goes to the same lateral angle and it has medial, lateral, superior, inferior nuclei course. After course, it goes again to the opposite side, but vestibular part has very wide connection to all parts of brain, to the cerebellum, to the midbrain, to give information. Important part goes to the third neuron. So, third neuron placed in anterior tubercle of thalamus. There are nuclei ventrolateralis, most important nuclei. All sensory tracts, except smelling, hearing, and vision, goes to these nuclei. After ventrolateral nuclei of thalamus, it goes to the sensory cortex, pass through the capsula interna to the sensory cortex, gyrus os centralis.
Which leg of internal capsule?
Okay?
Which leg? Posterior leg of
Posterior
internal
part of
capsule.
posterior.
Yeah, it goes behind knee, between posterior part of posterior leg and knee.
Between.
Yes. Tractus thalamo-corticalis.
Ah.
There is tractus thalamo-corticalis. All tract goes to the gyrus postcentralis. So, that's all for today. Now you can understand why we learn tracts. For example, now we have nervus trachearis. We said tractus corticonuclearis. Two nuclei, two core, two neuron. What does it mean? First neuron placed in gyrus precentralis, motor cortex. Then goes to the second neuron. For nervus trachearis, second neuron is nucleus motorius nervi trachearis. So before nucleus motorius nervi trachearis makes cross. So tract is crossed. Okay. After cross, nerve goes to the same side. So after second neuron, not cross. Before second neuron. Okay. So if I ask you about what about nervus oculomotorius, you should say me only about nervus oculomotorius. But if I say how to innervate musculus rectus inferior, you should say first neuron placed in gyrus precentralis motor cortex, then goes to the opposite side to the nucleus motorius nervi oculomotorii, then goes to the same side, pass through the fissura orbitalis superior as part of nervus oculomotorius to the musculus rectus inferior. And now you know first little part of parasympathetic system. You know how to innervate musculus sphincter pupillae and musculus ciliaris. Little part of parasympathetic system. Okay? Okay, remember it. So, I will give you all innervation, and on the final viva, I will ask you innervate please eyeball autonomic innervation, and you should me explain innervates musculus dilatatum pupillae, next class, and about musculus sphincter pupillae, you should say me about nervus oculomotorius and musculus ciliaris too. That's all. And we have pons. On the pons, behind pons, we have common exit from brain, nervus facialis and nervus vestibulocochlearis. But nervus facialis goes out of brain, nervus vestibulocochlearis goes inside of brain. So, and here is angle between cerebellum and brain stem. Is number 5, trigeminal nerve, nervus trigeminus. This is classical mixed nerve. It has only motor and sensory fibers, that's all. So only motor and sensory nucleus. If you have mixed nerve, you should start with nuclei. What kind of nuclei has nervus trigeminus? Nervus trigeminus has nucleus motorius nervi trigemini, upper part of rhomboid, upper half of rhomboid fossa, and 3 sensory nuclei. Nucleus mesencephalicus in midbrain, nucleus pontinus, and nucleus spinalis, nervi trigemini. 3 sensory, 1 motor. Then nervus trigeminus goes out of brain by 2 routes, radix sensoria and radix motoria. Goes out of brain along the line linea trigemino-facialis, between trigeminal nerve and facial. Behind pons we have line, and nervus trigeminus goes out of brain. Then radix sensoria form ganglion. Ganglion placed on the apex of pyramid. Here we have impressio trigeminalis. In this deep, in this fovea, lies ganglion. Ganglion trigemini. Impressio trigeminalis, ganglion trigemini. This ganglion is sensory, so belong to the sensory root, okay? No motor ganglion. And do you understand the logic? In the brain we don't have sensory cells. In spinal cord we have sensory ganglion outside of brain. For brain we have sensory ganglion again outside. So After ganglion, to root unit, motor and sensory root unit, and form nervus trigeminus. Now we have nervus trigeminus. Immediately, nervus trigeminus gives 3 branches. Nervus trigeminus, 3 branches. One branch, first, is nervus ophthalmicus. It goes to the fissura orbitalis superior, goes to the orbit, and gives 3 branches. Nervus ophthalmicus, first branch, gives again 3 branches. First branch goes to the forehead. Name is nervus frontalis. After fissura supraorbitalis, its name nervus supraorbitalis. Innervates skin of forehead and upper eyelid, partially. First branch. And I forgot to say, nervus ophthalmicus, first branch of nervus trigeminus, is only sensory, no motor fibers. After nervus frontalis, nervus ophthalmicus gives nervus nasociliaris. Second branch, nasociliaris. In the orbit, nasociliaris gives 3 branches. So, trigeminus, 3 branches. Ophthalmicus, 3 branches. Nasociliaris, 3 branches. Okay? Okay, nasociliaris goes to the 2 little sub-branches goes to the ethmoid bone. We have foramen medalis anterius, foramen medalis posterius, and we have 2 nerves. Nervus medalis anterius, nervus medalis posterius goes to the nasal cavity. Innervates sensory innervation of nasal cavity. Then, second branch goes as nervi ciliaris longi to the eyeball and gives sensory, usual sensory, pain, tactile, temperature innervation for eyeball. We used these nerves by oculomotor nerve. Oculomotor nerve, after ganglion ciliaria, gives communicative branch for musculus sphincter pupillae and musculus ciliaris. Use this sub-branch of nervus trigeminus. Okay? Nasociliaris. Last branch is nervus infratrachearis. It goes to the medial angle of eye. Medial angle of eye innervates sacculus and the skin of medial angle of eye. Last branch is nervus lacrimalis. So, frontalis, nasociliaris, lacrimalis. Lacrimalis goes to the lacrimal gland. 6 lacrimalis, yes. Lacrimalis goes to the lacrimal gland. Innervates lacrimal gland and lateral angle of eye. But gives only sensory. This nerve is motor and sensory, no vegetative innervation. Usual sensory innervation for lacrimal gland and lateral angle of eye. That was first branch, ophthalmicus. Second branch is maxillaris. So logic is ophthalmicus, maxilla, mandibula. Okay? So second main branch is nervus maxillaris. Nervus maxillaris goes to the foramen rotundum. Do you remember? Fissura orbitalis superior, foramen rotundum. By foramen rotundum, nervus maxillaris goes to the fossa pterygopalatina. Then it passes through the fossa pterygopalatina and goes to the orbit again, using fissura orbitalis inferior. Yes, you already learned, yes? Fissura orbitalis inferior. It doesn't have connecting with ganglion, it's sensory. But from ganglion to this nerve, we have connective branches. So, when it passes through the fossa pterygopalatina, it takes parasympathetic innervation with it. So, after fossa pterygopalatina, because it passed through the fissura orbitalis inferior, it has name nervus infraorbitalis. And infraorbitalis divided on 2, nervus zygomaticus for lateral part, for zygomatic region, chin bone region, and nervus alveolaris inferior pass through the foramen infraorbitale. Alveolaris inferior innervates superior gingiva, lips, and teeth superior. Nervus zygomaticus take connective branches from ganglion pterygopalatinum Connective branches pass through the nervus zygomaticus, then switch to the nervus lacrimalis, then goes to the lacrimal gland and gives parasympathetic innervation for lacrimal gland. So, maxillaris pass through the fossa pterygopalatina. Connective branches from ganglion switch to the nervus zygomaticus, then nervus lacrimalis, then to the lacrimal gland. Okay? Not itself, not trigeminal gives parasympathetic innervation, but it gives pathway. Last branch is nervus mandibularis. Nervus mandibularis goes out using foramen ovale. Foramen ovale for nervus mandibularis. So, fissura orbitalis superior, foramen rotundum, foramen ovale. I said trigeminal nerve has motor and sensory nuclei. These two branches only sensory, only last branch motor and sensory. So nervus mandibularis goes out of skull and gives motor and sensory branches. What motor? It innervates all masticatory muscles. Musculus, nervus masseter, nervus temporalis profundus for temporal muscle, and two pterygoid, medial and lateral, all masticatory. Second part of motor branches innervates two tensor muscles, musculus tensor veli palatini, musculus tensor tympani. Do you remember tensor tympani in tympanic cavity? Now we innervate it. And last branch has name nervus mylohyoidus. They have musculus mylohyoidus, so innervates with this muscle. And also it innervates anterior venter of musculus digastricus. This is motor part of nervus trigeminus. And sensory branches. Sensory branches of nervus trigeminus. So, nervus trigeminus, sensory part. It gives innervation for skin of face. So, first branch is important and it named nervus auriculotemporalis. Innervates meatus acousticus externus, partially auricula. It innervates temporomandibular joint, region of temple, temporal region, yes? And it gives sensory innervation for parotid gland, only sensory, pain, temperature, and tactile. With nervus auriculotemporalis, because of it takes parasympathetic innervation, also it gives parasympathetic innervation, but not by nervus trigeminus. Other nerve gives connective branches and using auriculotemporalis for parasympathetic innervation of parotid gland. So, auriculotemporalis. Next, nervus zygomaticus for zygomatic region. Nervus buccalis for buccal region. So, innervates skin and mucus of cheek. Next, nervus alveolaris inferior. It innervates skin of mandible, gingiva, teeth. And last is nervus lingualis. Nervus lingualis goes to the tongue and gives sensory usual innervation for part of tongue. What part of tongue? Anterior 2/3 of dorsum of tongue. So upper surface, anterior 2/3, innervation innervated by nervus trigeminus, but only sensory innervation. Pain, tactile, and temperature, that's all. Also, nervus lingualis gives, it's not here. Nervus lingualis gives branch, nervus sublingualis, that goes to the two gland, glandula submandibularis, glandula sublingualis, and again gives only sensory innervation for this gland, pain, temperature, and tactile. This is trigeminus. Next nerve is nervus facialis, facial nerve. Nervus facialis is mixed. It has sensory, motor, and vegetative nuclei. So, nervus facialis, motor, nucleus motorius nervi facialis. Next, nucleus, so this is motor. Nucleus salivatorius superior, this is vegetative. And nucleus tractus salitarii, sensory. So, three nuclei for nervus facialis. It goes out of brain using by linea trigeminofacialis, behind pons, a little behind pons. Then it goes to the Meatus acousticus internus. Inside meatus acousticus internus, we have enter to the facial canal. Inside this bone, we have facial canal. Remember? So this is left bone. Facial canal goes laterally to the knee, turn back, goes back to the eminentia pyramidalis, turn down, and goes down. Exit is foramen stela mastoidum. Okay, so nervus facialis inside this canal make all these turns and goes out foramen stela mastoidum. Inside pyramid, inside canal, it gives three branches. What branches? First is nervus petrosus major. Nervus petrosus major, after knee, goes out of brain on the anterior surface. In hiatus canalis nervi petrosi majoris. Then lies in groove, sulcus nervi petrosi majoris. Then goes to the pterygoid canal. At the base of pterygoid process, we have pterygoid canal and goes to the fossa pterygopalatina. Fossa pterygopalatina. 15? Fossa pterygopalatina. So it goes to the ganglion. This is parasympathetic part of facial nerve. So here is switching. So here is ganglion, switch. Then we have three branches. First branch goes to the nasal cavity. Rami nasalis posterioris. Why posterioris? Because it innervates posterior part of nasal cavity. It goes to the foramen sphenopalatinatum and innervates glands of posterior part of nasal cavity. Parasympathetic innervation for glands. Second branches goes to the oral cavity. We have palate on the oral cavity. So palate upper part belong to the nasal cavity, lower for oral cavity. So nervi palatini innervates glands of palate inside oral cavity. It using canalis palatinus major. And third branch is connective branch, goes to the nervus zygomaticus, using it. Then using nervus lacrimalis, then goes to the lacrimal gland. So innervates, gives parasympathetic innervation to the lacrimal gland using two branches of trigeminal nerve, zygomaticus and lacrimalis. Okay? Now, you know innervation of lacrimal gland. First branch. Second branch is nervus stapedius. Inside facial canal, second branch of nervus facialis is nervus stapedius. It goes to the musculus stapedius. Innervates only one muscle. Now you innervate both muscles of tympanic cavity. Third branch is a very special name. Only this nerve has this very special name. This is chorda tympani. If translate, this is drum string. Drum, yes, and string, little string. So chorda tympani, drum string. Only this special nerve, only one nerve. So chorda tympani goes inside tympanic cavity, lies on the tympanic membrane inside tympanic cavity, then goes to the slit, fissura petrotympanic, and goes out of brain. So fissura petrotympanica goes out of brain. Outside of skull, it goes to the end. Where is the end? So chorda tympani has sensory and parasympathetic fibers. So nucleus salivatorius superior, parasympathetic, and nucleus tractus solitari, sensory. It goes to the nervus lingualis. Parasympathetic part switch to the ganglion. What is ganglion? Ganglion submandibulare. So then, after ganglion, both fibers goes to the nervus lingualis, part of trigeminal nerve. Sensory part goes with nervus lingualis to the tongue and gives taste, so gustatory innervation for anterior two-thirds of tongue. So papilla we innervate with nervus facialis using nervus trigeminus. Parasympathetic part goes to the glands, glandula sublingualis, glandula submandibularis, using nervus sublingualis, last branch of nervus lingualis. So this is chorda tympani, taste and parasympathetic innervation. So then facial nerve, after three branches inside canal, goes out of brain, foramen stylomastoidum, and gives only motor branches. No sensory, just motor. What motor branches? So, porus acousticus externus, outside ear, auricula, and we have three muscles: auricularis posterior, auricularis superior, auricularis anterior. So, for musculus auricularis posterior, we have separated nerve, nervus auricularis posterior. Then we have musculus digastricus. Nervus digastricus or ramus digastricus innervates musculus digastricus posterior venter and musculus stylohyoidus close to it. Then motor branches form plexus, lies in front of parotid gland, so plexus parotidus. And the plexus parotidus innervates like foot of crow, foot. So it innervates nerve rami temporalis innervates auricularis superior, auricularis anterior, and frontal venter of musculus epicranium and muscles around eye. Next, nerve rami zygomatici innervates muscles, musculi zygomatici and muscles around eye. Again. Ramus buccalis innervates musculus buccinator and muscles around mouth, upper part. Then, for lower mandible, for lower jaw, mandible, we have nervus marginalis mandibularis, innervates muscles of mandible, mentalis, paramentalis. And last part is ramus colli. Ramus colli goes to the neck and innervates musculus platysma. 5 branches. Да, 5. You should understand logic. So, nervus trigeminus, motor and sensory. But for nervus trigeminus, upper branch ophthalmic, sensory, second, sensory, only third, motor and sensory. And nervus trigeminus give sensory innervation for face. So if you don't feel, this means nervus trigeminus. Then nervus facialis. When it goes out of foramen stylomastoidus, out of skull, it gives motor innervation. All muscles of face innervated by nervus facialis. So if we see a little difference between left and right part, that means muscle innervated by nervus facialis. So damage of nervus facialis. So if you see lower angle of mandible or opens eye and tear cannot be stopped, so it means nervus facialis. Okay. Vegetative system. You should understand it. Vegetative system goes only till the ganglion with nerve, so it has a name of nerve. After ganglion, we have branches that use other nerve. For head, this nerve is trigeminal nerve. So parasympathetic system, after ganglion, use trigeminal nerve on the head. Okay. Last part of cranial nerves, we have 4. First is number 9, glossopharyngeal nerve, nervus glossopharyngeus. This is mixed. It has 4 nucleus. First is vegetative, nucleus salivatorius inferior. Then motor, nucleus ambiguus, and sensory, nucleus tractus salitarii or nucleus solitarius. Nucleus nervus glossopharyngeus goes out of brain behind olive in sulcus posterolaterales. Then it goes out of skull using foramen jugulare. Foramen jugulare. Above and below foramen jugulare, it form 2 ganglion, ganglion superius and ganglion inferius. This is sensory ganglion. Do you remember the rule? No sensory neuron in the brain.
Yes.
So, after foramen, it goes in front to the root of tongue and gives terminal branches. First branch named nervus tympanicus. Nervus tympanicus goes back to the tympanic cavity. Inside pyramid, it goes inside pyramid and innervates mucosa of tympanic cavity and auditory tube. Last part, sub-branch of nervus tympanicus, named nervus petrosus minor. It goes out, hiatus canalis nervi petrosi minoris, lies in the groove, sulcus nervi petrosi minoris, then goes out of skull again and goes to the ganglion oticum. After ganglion oticum, switch, this is parasympathetic part, switch and postganglion fibers goes with nervus auriculotemporalis to the parotid gland and gives parasympathetic innervation. Second branch of nervus glossopharyngeus is nervus stylopharyngeus, only for muscle, musculus stylopharyngeus. Then rami pharyngii goes to the pharynx and form plexus pharyngeus with nervus vagus, vagus nerve. Plexus pharyngeus innervate pharynx, motor, sensory, and vegetative too. Next branch is rami tonsillaris. They goes to the tonsilla and arches. Innervates tonsilla and arches. Then branch goes to the lingual, to the tongue, rami lingualis, and innervates posterior third of tongue. Gives both innervation, usual sensory and taste innervation for posterior third of the tongue, dorsum of tongue. So one more nerve, innervated tongue. Last branch is ramus sinus carotice. We have carotid artery that gives bifurcation. In the angle we have part of endocrine system, sinus caroticus. So this branch innervates this sinus, sinus caroticus. 6 branches, yes. Next is vagus nerve, number 10. Nervus vagus. It also mixed. It has vegetative nucleus dorsalis nervi vagi, motor nucleus ambiguus, and sensory again the same, nucleus tractus solitarius or nucleus solitarius, tractus solitarii. Vagus nerve goes out to brain again behind olive in sulcus posterolaterales. Goes out of skull again using foramen jugulare. Again it forms ganglion superius and ganglion inferius, sensory ganglion. Then vagus nerve lies between vena jugularis interna and arteria carotica interna. Lower it lies between vena jugularis interna and arteria carotica communis. Then pass through the apertura superior to the thorax cavity. In the thorax cavity, right nerve lies in front of arteria subclavia, left nerve lies in front of aortic arch. Pass through the root of lung, in front of root of lung, then lies laterally from esophagus. When it goes to the abdominal cavity, left goes in front, right goes behind. So in abdominal cavity, left in front of stomach form plexus, right behind stomach for plexus. So we have 4 parts of vagus nerve. Cranial part, you should know only 2 branches. Ramus meningeus for dura mater, posterior part. Ramus auricularis for partially auricular and meatus acousticus externus posterior wall, sensory branch. Neck part has rami pharyngii, goes to the plexus pharyngeus and support pharynx. Then nervus laryngeus superior for upper half of larynx, and because of larynx it also innervates epiglottis, upper half, and because very close to epiglottis we have a root of tongue, it also innervates root of tongue. So one more nerve innervates tongue. Last branches goes to the thorax cavity from neck and innervates heart, form plexus. So branches name rami cervicalis ramicardiaceae cervicalis, superior and inferior. Goes and form plexus for heart. Thoracic part. First branch is nervus laryngeus recurrens. So, nerve lies in front. Laryngeus recurrens goes below and then goes back. Recurrence means goes back. When it goes back, its name already nervus laryngeus inferior. It innervates partially esophagus, partially trachea, partially bronch, and it goes up and innervates lower half of larynx till vocal fold. Also it innervates thyroid gland, thymus, and lymphatic vessels. And in thorax cavity we have branches for esophagus, rami esophagealis, for trachea and bronch, rami trachealis, then goes to the plexus pulmonalis for lungs. And branch for heart branches, rami cardiaceae thoracicae, form plexus for heart. In abdominal cavity, vagus nerve innervates all organs till sigmoid colon, rami pancreaticae, rami hepaticae, rami lienalis, for kidney, rami renalis, and small and large intestine till sigmoid colon. So sigmoid colon, last part. So very wide innervation. Next nerve is 11th. Nervus accessorius, accessory nerve. Accessorius only motor, only two nucleus. Nucleus motorius, nervi accessory, or you can say nucleus nervi accessory, and nucleus ambiguus again. It goes out of brain again behind the olive, in sulcus posterolaterales. And again, then use foramen jugulare, the nerve. Again lies between vena jugularis interna, arteria carotica interna, and then gives two branches. One branch is external, ramus externus, ramus internus. Ramus internus goes back to the vagus nerve. Because of this, its name accessory, like additional to the vagus. And ramus externus goes and blood supplying only two muscles, musculus trapezius and musculus sternocleidomastoideus stabilis. That's all. Last nerve is hypoglossal nerve. 12. Nervus hypoglossus. Only motor, only one nucleus. Nucleus nervi hypoglossi. Or you can say nucleus motorius nervi hypoglossi. It uses first out of brain. Out of brain it goes in front of olive, in sulcus anterolaterales, like anterior root of spinal cord. So it looks already like spinal nerve. In front of olive, then goes out of skull. It uses canalis nervi hypoglossi or canalis hypoglossalis in occipital bone. Well, here. Yes, here. After canalis nervi hypoglossi, it goes to the posterior border of musculus mylohyoideus and form arch. Arch convex downward. So arch. And this arch is border of triangle of Pirogov. Triangle of Pirogov, posterior border of musculus mylohyoideus, nervus hypoglossus, and below musculus digastricus. In this triangle you can find arteria lingualis. Okay. Region of innervation, only motor, so nervus hypoglossus innervates all muscles of tongue, both skeletal and its own muscles of tongue. One more nerve innervates tongue. And this nerve gives branches. One branch to the musculus geniohyoideus, this is muscle above hyoid bone. And second branch, ramus superior, for muscles below hyoid bone. And this branch superior unite with branch inferior from cervical plexus, from spinal nerves, and form loop ansa cervicalis profunda to innervate muscles below hyoid bone. So nervus hypoglossus, in common, innervates muscles of tongue, geniohyoideus, and muscles below hyoid bone. Okay, that's all. Is middle, For example, trigeminal and facial is very big. I will give you only branch. Yes. Middle is auricularis,
Olfactory.
vestibularis, part of vestibularis, or cochlearis, or oculomotorius. It's middle, yes. Trochlea abducens is little, so I will give you 4, 6, and maybe 1 together. Yes. 3 little. Вот. But I won't ask you about what is the beginning, then, and where is the end. I will ask you which muscle innervates, what nerve innervates musculus rectus lateralis? Abducens. Okay, you know. Which nerve innervates musculus obliquus superior? Trochlearis. Okay, you know it. So that's okay. So you know axillary apparatus 5. And did you pay attention that we have 5 nerves that innervates tongue? So dorsum of tongue, anterior to third, usual sensory trigeminal, taste, facial. Posterior third is glossopharyngeal.
Glossopharyngeal.
Root of tongue, vagus. All muscles, hypoglossal.
Hypoglossal.
5 nerves. That's all for today. You remember we have sensory nerve, sensory part of nerves. So, for example, trigeminal nerve, sensory ganglion, ganglion trigemini, outside of brain. Skip 6, 7th, ganglion cuniculi, outside of brain. 8, 9, ganglion superius inferius, above foramen and below foramen ligulare. Vagus, ganglion superius, ganglion inferius, above, below foramen ligulare. No sensory neurons. Okay. Then pay attention. If you said me usual sensory innervation, if you skip ganglion, switching in ganglion, it's okay. If you ask me tract, you should say ganglion, yes? So nucleus, then ganglion, then region, organ. But if you answered me, I will explain this one more time on the next class. If you answered me parasympathetic or sympathetic system, you should say ganglion. For example, parasympathetic innervation of eye, you should say ganglion ciliare. For parotid gland, you should say ganglion oticum. For sublingual submandibular gland, ganglion submandibulare. Okay, don't forget about ganglion for vegetative autonomic system, because there is the switch. This is important. And for parasympathetic system, postganglionic fiber uses other nerve. If you talk about head, always use the general nerve. That's okay. But give me a sensory innervation of eye. And parasympathetic and sympathetic. If you answered me parasympathetic, you should say musculus sphincter pupillae and musculus ciliaris. I will ask you, where is musculus sphincter pupillae? You answered me, in iris. What is iris? Second shaft of eye. Okay, you know eye. This topic is autonomic system. Autonomic system has 2 parts. It has sympathetic and parasympathetic. First is sympathetic. On the spinal cord, gray matter, we have posterior, lateral, anterior horn. On the lateral horn, in the lateral position, we have substantia intermedio lateralis. This is vegetative nucleus. And from cervical 8 till lumbar 3, substantia intermedia lateralis is center of sympathetic nervous system. After substantia intermedia lateralis, we have anterior root, goes to the spinal nerve, and then we have branches. Rami communicantens albi, white communicans branch, that goes to the ganglion. Rule for autonomic system first is center, then preganglionic fibers, then ganglion should be anywhere, then we have postganglionic fibers. So, in front of spinal cord, in front, we have preganglionic, prevertebral ganglion. Laterally, we have paravertebral. Paravertebral ganglion lies close to the spinal cord, right after foramen intervertebrale. And a lot of ganglion form chain name truncus sympathicus. Sympathetic trunk form right and left chain, and one ganglion is impaired, so they are connected to each other. White communicans branch should go to the trunk, sympathetic trunk, and can switch or pass through sympathetic trunk. Upper part switch, lower part pass through sympathetic trunk. So we have from cervical 8 to the lumbar 3, this is center. Then we have preganglionic fibers, goes to the sympathetic trunk. On the sympathetic trunk we have 3 cervical, then 10 or 12 thoracic, 4 or 5 lumbar, 4 sacral, and 1 coccygeal. Form 2 sympathetic trunk. 3 cervical. First cervical ganglion cervicalis superius gives nerves, branches. Nervus jugularis, nervus caroticus internus, nervus caroticus externus, and nervus cervicalis cardiacus superior. Then second cervical, nervus cardiacus cervicalis medius. Then last inferior gives nervus cardiacus cervicalis inferior and nervus vertebralis for vertebral artery. Thoracic gives for heart thoracic branches. So rule for sympathetic system: after ganglion, postganglionic fibers goes to with vessel, blood supplying vessel, sometimes with vein, because around vein we have 2 plexuses. So next, thoracic part. Thoracic part gives branches: nervi cardiaci cervicalis thoracici, nervi cardiaci thoracici, and nervi esophagealis, nervi bronchialis, nervi trachealis, that form plexus pulmonalis. And for thorax we have, for head and neck we have cervical 8, thoracic 1. For thorax cavity we have thoracic from 2 till 6. And all preganglionic fibers switch to the ganglion, in the ganglions. After 6 thoracic, we have segments for abdominal cavity. From thoracic 6 or 7 till thoracic 12. Sometimes, and then we have thoracic, then we have lumbalis. For after lumbal cavity we have pelvis. So what's the difference? Upper part, cervical 8 and cervical and thoracic 1, goes to the cervical ganglion and switch. First thoracic segments goes to the thoracic and switch. Then for abdominal cavity, preganglionic fibers form nerves that not switch in the sympathetic trunk. It goes to the another ganglion. For pre-vertebral ganglion, there are plexuses. We have plexuses. So, sympathetic trunk paravertebral, plexuses pre-vertebral ganglion. Okay? So, after thoracic cavity, we have from 6 to the 10. First, we have nervus splanchnicus major. Goes later, pass through the ganglion, sympathetic trunk. Then we have nervus splanchnicus minor, pass through. Then lumbar segments gives nervi splanchnici lumbalis, and then nervi splanchnici sacralis. There goes to the plexuses. We have plexus celiacus, mesentericus superior, aorticus abdominalis, mesentericus inferior, and 2 hypogastric, superior and inferior. But there is difference between splanchnicus major goes only to the plexus celiacus. Splanchnicus minor goes to the both celiacus and mesentericus superior. Lumbalis goes almost to the all plexuses, mesentericus superior, aortic abdominalis, mesentericus inferior, and both hypogastric. And sacralis goes to the hypogastric. And you should remember what organs innervates from plexus, because not nerve innervate organ, plexus innervate organ. Plexus celiacus gives innervation for 4 organs: stomach, pancreas, liver, and first half of duodenum. Till first half of duodenum. Then mesenteric superior plexus innervates second half duodenum and half of transverse colon. Then aortic abdominalis is very special for gonads only and for kidney only 2 organs. Then mesenteric inferior from second half of transverse colon till upper third of rectum. And hypogastric for organ of pelvis, means from second third of rectum. Okay? So this is sympathetic system. And now you can give me innervation, sympathetic innervation of every organ. For example, so kidney. You should remember, kidney is here. So this is plexus aorticus abdominalis. So nervi splanchnici lumbalis. Nervi splanchnici lumbalis. Nervi splanchnici lumbalis from thoracic 10 to the lumbar 1 or thoracic 12. So you should say, and you should me give only 4 sentences, that's all. Center, pre-ganglionic fibers, ganglion, post-ganglionic fibers. So where is the center? Substantia intermedio lateralis at the level of thoracic 6, from thoracic 6 to the thoracic 10. Then preganglionic fibers goes as radix anterior, spinal nerve, rami communicantens albi, and form nerve, nervi splanchnici lumbalis. That goes, nervi splanchnici lumbalis second, that goes to the plexus, plexus aorticus abdominalis. This is ganglion, aorticus abdominalis. And then postganglionic fibers goes to the organ. So this is sympathetic system. Now parasympathetic system. Parasympathetic system has almost the same rule, except one excluding. Postganglionic fibers goes with other nerve. Do you remember on the head? Used trigeminal nerve. So, and partially you already know parasympathetic system. You know cranial part of parasympathetic system. Number 3, 7, 9, 10 nerve. There have vegetative nucleus. So this is cranial part. And where is spinal part? The same, substantia intermedia lateralis, but at the level sacral 2, sacral 4. Form nerve that pass through the sympathetic trunk. It's not sympathetic system, so pass through. And form nervi splanchnici pelvinii. Goes to the plexus hypogastricus, switch and use other nerve to reach organs of pelvic cavity. And rectum, because vagus nerve innervates till rectum with sigmoid colon, before rectum. Okay? Now you can give me parasympathetic innervation. For example, rectum. You should say me, substantia intermedia lateralis at the level sacral 2, sacral 4. Form. So this is center. Then preganglionic fibers. Radix anterior, spinal nerve, rami communicantens albi, form nerve, nervi splanchnici pelvinii. Goes to the plexus, plexus hypogastricus, and switch. And goes to the then postganglionic fibers. One more information I forgot to say on previous topic, on previous class. Ganglion can be intramural or peri-organ. What does it mean? If organ has wall, for example, stomach, parasympathetic ganglion is inside wall, intramural. If organ doesn't have hollow, it's not cavity, without cavity, like liver. So ganglion around organ, peri-organ. Okay? So every organ, hollow organ with wall, intramural ganglion. Every organ without cavity, parenchymal organ. Ganglion around organ, peri-organ ganglion. That's all.
Total
3 cervical ganglion.
Total 12 cervical segments. Thoracic.
thoracic 10 to 11 ganglions, but thoracic all the time. 12 thoracic segments.
Sir, and this one are paravertebral ganglion.
Yes, this in front, in abdominal cavity, so this is pre-vertebral, in front. Sympathetic trunk very close to the vertebra, laterally from vertebra, so paravertebral.
So these all are paravertebral.
All of this pre-vertebral.
Prevertebral.
Pre-vertebral. Sympathetic trunk close, laterally, paravertebral. Para next to, pre in front. So, how to, on the next class, I will give you task, one organ, and you should give me sympathetic and parasympathetic innervation of organ. One example is lacrimal gland is in the text, and one more example, I don't remember what is this. So let's take other example. For example, parotid gland. Okay. So parotid gland, you should me write sympathetic and parasympathetic innervation. For sympathetic, it's very easy. You always should start with substantia intermedia lateralis, only here. So, gland on the head, it means only cervical, only upper cervical. So, you should be answering substantia intermedia lateralis, level cervical 8, thoracic 1. This is center. Then, radix anterior, spinal nerve, rami communicantens albi goes to the upper cervical ganglion. Ganglion cervicalis superior. So prevertebral and ganglion, you write it. Then you should write postganglionic fibers goes with blood supplying vessel. That's all. For now. When we learn angiology, you should write me what is the vessel. For now, it's okay. Then paravertebral innervation. Again, 4 sentences. Where is the center? So, parotid gland. Salivatorius inferior. So, this is glossopharyngeal nerve. So, you should answer me. Nucleus salivatorius inferior. This is the center. What is preganglionic fibers? Nervus glossopharyngeus, nervus tympanicus, nervus petrosus minor, preganglionic fibers. Where is ganglion? Ganglion oticum. Ganglion oticum. And postganglionic fibers, nervus auriculotemporalis. So you need all knowledge in one. Okay?
Sir, and you told spinal nerve switch to the ganglion, and some of them pass through the.
Not spinal nerve. Spinal nerve goes like usually like motor and sensory. It has vegetative, but vegetative goes to the ganglion, sympathetic trunk, then goes back like other branches if it needs. To the ganglion, rami communicantens albi, that goes back, rami communicantens grisi. Okay? Spinal nerve doesn't go to the sympathetic trunk. Only branches, and branches goes back.
And what is pass through? Pass through means how?
Upper half goes to the trunk and switch, and goes as different branches. Lower half, after thoracic 6, form nerve. Pass through the sympathetic trunk and form nerve.
Means they don't have any ganglion.
Not have ganglion in sympathetic trunk. Ganglion on the plexus, closer to the organ. And parasympathetic system have ganglion inside organ, in the wall or around.
Only one ganglion.
Intramural or periorgan.
Only one ganglion there.
Yes. One fibers has only center and one ganglion. Next classes we will learn that spinal nerve has 4 branches. Next class. And one branch you should remember already about rami communicantens albi. Okay? So, last part, peripheral nervous system. We start learning about spinal nerves. How many segments? So we have spinal nerves. We have 31 segments, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, 1 coccygeal, 31. And the same, we have 31 spinal nerves. Today we start learning about cervical spinal nerves. So after cervical segments, we have anterior root and posterior root, motor and sensory, form spinal nerves. And also we have ganglion, ganglion spinalis. This is sensory ganglion, placed usually in foramen intervertebrale. So spinal nerve is mixed, motor and sensory. All spinal nerves are mixed. Spinal nerve has 4 branches. One you already know. This is rami communicantens albi that goes to the sympathetic trunk. Second branch goes back to the spinal cord for dura mater, ramus meningeus. Third and fourth branches is ramus anterior and ramus posterior. You can say ramus ventralis anterior, ramus dorsalis goes behind. Today we learned about spinal nerves, so we learned about anterior and posterior branches of cervical spinal nerves. So 8 spinal nerves cervical and 8 dorsal branches. You should know only 3. After first cervical spinal nerve, we have nervus subaccipitalis that goes to the occipita vertebral group, 4 muscles, and innervate them. So this is motor branch, subaccipitalis. Second branch, nervus accipitalis major. It goes to the occipital region and innervate lateral part of occipital region, accipitalis major. Third, after segment number 2, is nervus accipitalis tertius, number 3, segment 3. Nervus accipitalis tertius innervates occipital region and neck region. So second and third, accipitalis major and accipitalis tertius, are skin branches, okay, sensory branches only. Now anterior branches. Both anterior branches of cervical at first form plexuses, then form branches. And we have 2 plexus. Upper 4 nerves, spinal, gives anterior branches and form cervical plexus. So, what is cervical plexus? This is anterior branches of upper 4 cervical spinal nerves. Where is cervical plexus? So, region of neck, we have cervical plexus and brachial plexus. Cervical plexus placed laterally from transverse processes. It lies between group of deep muscles, so between prevertebral and musculus scaleni. In front of cervical plexus we have musculus sternocleidomastoideus that covered it. So this is cervical plexus. Cervical plexus gives branches. 4 skin branches, 2 muscle motor branches, and 1 mixed. What about skin branches? Do you remember on the back branches we have accipitalis major and accipitalis tertius. Where is the second? Second is from cervical plexus. It goes back, nervus accipitalis minor, and innervate medial part of occipital region. Then nervus auricularis magnus. It innervates auricula and meatus acousticus externus. You can see accipitalis major, minor, and auricularis magnus on the chart. Next, next is nervus transversus colli. It innervates skin on the neck. On the neck we have musculus platysma, so it innervates skin above platysma. And it forms loop with motor branch from facial nerve, ramus colli, that innervates platysma. Loop name is superficial cervical loop, ansa cervicalis superficialis. So, ansa cervicalis superficialis is formed by ramus transversus colli from cervical plexus and ramus colli of facial nerve. Ramus colli innervates platysma, ramus transversus colli of cervical plexus innervates skin above platysma. Okay? Last is, here we have clavicle supraclavicularis. Ramus supraclavicularis innervates skin above clavicle and partially below clavicle. That was that were 4 skin branches. Now 2 motor branches. First is usual name, rami muscularis, that innervates deep muscles of neck, prevertebral group and scalene muscles, and also muscles between transverse processes, musculi intertransversarii cervicalis. Second branch named radix inferior. Radix inferior unite with radix superior from hypoglossal nerve and form deep cervical loop, ansa cervicalis profunda, that innervates muscles below hyoid bone, sterna hyoidus, sterna thyroidus, thyrohyoidus, omohyoidus. And now you should know name of this loop. This is Zagorsky loop. Петля Загорского. Zagorsky loop. And last branch is mixed. Mixed is phrenic nerve. Only 2 nerve goes to the thoracic cavity. So this is vagus nerve and this is phrenic nerve. What is differentiation? Differ is vagus nerve goes to the head. It's not ends here. And phrenic nerve start here. So, for example, this is part of phrenic nerve and you can see beginning from cervical plexus. Phrenic nerve goes in front of vessels, apertura thoracica superior, lies in front of root of lung and goes laterally from pericard to the diaphragma. Other name of diaphragma is musculus phrenicus. So it innervates phrenic muscle and then even goes to the abdominal cavity. And skin part innervates pericard and goes to the liver, phrenico-abdominalis branch. So innervates also liver. So skin and motor, mixed branch. That was cervical plexus. And also we have brachial plexus. Plexus brachialis. What is plexus brachialis? Plexus brachialis is formed by anterior branches of lower 4 cervical and first branch of thoracic spinal nerve. So 5 anterior branches form brachial plexus. Then brachial plexus form 3 bundles, lateral, medial and posterior around vessel, arteria subclavia. Then goes to the axillary cavity behind vessel, with vessel. It lies, because behind vessel, it lies between musculus scalenus anterior and musculus scalenus medius behind vessel. And brachial plexus has long and short branches. For today, only short branches. We have 7 short branches, 6 motor, 1 mixed. What about motor? So motor branches goes, 3 branches goes back. Where? So first branch goes along medial border of scapula, ramus dorsalis scapulae, and innervates muscle musculus levator scapulae and musculus rhomboideus. Second branch goes to the notch of scapula, nervus suprascapularis, and innervates musculus suprascapularis and musculus infrascapularis. Next branch goes along rib cage. Along rib cage. So, above scapula, this looks like above scapula, suprascapularis. This looks like nervus thoracicis longus. It goes along rib cage and innervates musculus serratus anterior. Do you remember? 9 teeth from rib, so long nerve. Then here we have pectoral muscles, and we have nervi pectoralis medialis for greater, pectoralis lateralis for lesser. Then we have clavicle here. Below we have muscle, musculus subclavius. We have nervus subclavius for musculus subclavius. Then we have scapula. Between rib cage and scapula we have nervus subscapularis. That innervates musculus subscapularis, musculus teres major, and last teres major here. And last part of this nerve subscapularis named nervus thoraco dorsalis that goes to the latissimus dorsi. So 3 muscles. So, last branch, seventh, is nervus axillaris. Nervus axillaris is mixed. It goes to the foramen quadrilaterum, so you can find it easily. Only one nerve goes to the foramen quadrilaterum. And innervates musculus deltoideus, musculus teres minor, and terminal branch of axillaris is skin. It innervates upper part of lateral region of shoulder. So, for skin, it's cutaneus. And this is region. So, nervus cutaneus, brachii, lateralis, superior. That's all. Next class, I will give you writing tests. First question is about organ, sympathetic and parasympathetic innervation. Then organ, muscle or skin innervation. And then what is cervical or brachial plexus. That's all for today. So, brachial plexus, long branches. Do you remember that brachial plexus form three bundles? Medial, lateral, and posterior around artery. With artery it goes to the axillary cavity. Then from branches, starting long branches. So, do you see? This is bundle, and this nerve start from this nerve start from lateral bundle. This nerve. This is nervus musculocutaneus. Musculocutaneus pierced brachial muscle and goes to the lateral condyle, epicondyle, and goes to the forearm. So it pierced musculus coracobrachialis, so it innervates musculus coracobrachialis, anterior group of muscles, biceps, brachii, and brachialis, and then goes to the forearm and gives innervation for lateral part of skin. On the forearm we have lateral, medial, and posterior. Okay, so here region of innervation of nervus musculocutaneus. This is terminal branch. Terminal branch for skin, cutaneus, forearm. So nervus cutaneus antebrachii lateralis. Okay, terminal branch name. Because of this name, musculocutaneus for muscle and skin. Next nerve. So this is lateral bundle, this is medial bundle, and this looks like fork from two bundles, from lateral and from medial. This is nervus medianus. It lies in sulcus bicipitalis medialis. Then go to the cavity. Then lies in sulcus medianus. Goes to the canal, canalis carpalis, and to the hand. So, nervus medianus doesn't innervate anything on the shoulder. Nerve can do this. Doesn't innervate anything when it goes, but not artery. If artery goes here, it innervates around it tissue. Okay. So nerve goes to the forearm. On the forearm, this nerve innervates anterior group of forearm, except musculus flexor digitorum profundus and musculus flexor carpi ulnaris. Here it gives anterior branch for innervation of wrist joint, interosseous anterior. And on the hand, it innervates muscles of tenor, except musculus flexor pollicis brevis, deep head, except, and musculus adductor pollicis. And also it innervates first and second lumbricate muscles. Then nervus medianus gives also skin innervation. Skin of elevation of big finger, tenor, and innervate finger till fourth. So both surfaces on the fourth finger, only this surface. Okay, so border is here. This is nervus medianus. Next, only from medial bundle, this nervus ulnaris. Nervus ulnaris goes to the sulcus pituitaris medialis, goes behind medial epicondyle. You remember we have on the humerus sulcus nervi ulnaris. Lies in sulcus ulnaris, goes to the canalis carpi ulnaris, to the hand. This nerve, again, doesn't innervate anything here, goes to the forearm. On the forearm, it innervates only two muscles. At first, it innervates elbow joint. Then innervates two muscles. Musculus flexor digitorum profundus and musculus flexor carpi ulnaris. Now we innervate all anterior group. On the hand, it gives innervation for muscles of hypotenar, third, for lumbricals, all interosseum, and muscles in the tenor, musculus adductor pollicis and musculus flexor pollicis brevis, deep head. Now we innervate all muscles here. And also, nervus ulnaris innervate last part of here, ulnaris. So this surface and both surfaces of fifth finger. And also it innervates dorsal surface till third finger. So this and this is region of ulnaris. Okay? Ulnaris. Yes. Then we have two skin branches, very thin. Yes, like this. For forearm and shoulder, we have nervus cutaneus brachymedialis, nervus cutaneus antebrachymedialis. Innervates medial surface of shoulder of skin and medial surface of forearm. Only skin branches, two thin branches. And last is nervus radialis, at all 6 branches. Nervus radialis, only this nerve start from posterior bundle. So this looks like posterior bundle. Where is here? Yes, this. So this is nerve. Yes, nerve here. Nervus radialis. It goes behind, lies in sulcus spiralis. Sulcus spiralis with the musculus triceps brachyform canalis humero muscularis. So lies in this canal. Then goes to the forearm, lies in sulcus radialis, and then goes to this surface. So what innervates this nerve? Nervus radialis innervates posterior group, triceps brachii anconus, then gives two skin branches of shoulder. One branch take last part of shoulder on the lateral surface. Axillaris innervate upper part, radialis innervate lower part. So nervus cutaneus brachii lateralis inferior. Okay. And posterior surface, nervus cutaneus brachii posterior. Okay. Two branches but one nerve. Then it goes to the forearm. On the forearm it innervates all posterior muscle group and skin. So for skin, nervus cutaneus antebrachii posterior. Then goes here. Because we already innervate all muscles on the hand, doesn't innervate muscles, innervates only skin. So what skin? Dorsal surface from third to the first. Okay? So this is long branches. Now, okay, little bit later with legs. So now thoracic spinal nerves. We have 12 thoracic spinal nerves. The same, it has anterior, posterior, meningeal and rami communicant salvi. You know about rami communicant salvi already. Ramus meningeus goes back to the spinal cord. So what about dorsal branches? Posterior branches goes on the back and innervates both muscles and the skin. What about anterior branches? Anterior branches doesn't form plexuses. Anterior branches goes between ribs. So, because between ribs, its name nervi intercostalis. Not just anterior branches, intercostalis. So, this nerve again mixed and innervates both muscles and skin. Last nerve goes below last rib. So, this is nerve has little special name, nervus subcostalis. Okay? but function is the same, skin and muscles. That was thoracic nerves, spinal. Now what about lumbar? Where is lumbar? Do you remember musculus psoas? Or better here. Yes, here. Musculus psoas major. So, on the lumbar spinal nerves, we have again dorsal, ventral, ramus communicans albi, and ramus meningeus. Meningeus goes back. Ramus communicans albi you already know. Ramus dorsalis. Ramus dorsalis of lumbar and sacral form nerves that goes back and innervates only skin. Name is nervi clunei. Lumbalis form nervi clunei superior. Sacralis nervi clunei medii. Region of innervation this is gluteal region. Upper part is nervi clunei superioris from lumbar plexus. Dorsal branches of lumbar spinal nerves. And here is medial region, nervi sacralis spinalis. Sacralis. Dorsal branches. Okay. Also, we will have lateral region and inferior. Okay. Now, next. That was anterior. Now anterior. Anterior branches of lumbar spinal nerves form plexus, plexus lumbalis. It forms by partially from anterior branch of last thoracic 12, and 4 upper lumbar, and partially 3 upper lumbar and partially 4 lumbar. Okay, so what is lumbar plexus? Anterior branches of last thoracic, 3 lumbar and partially 4 lumbar. Okay. Lumbar plexus placed inside in the thickness of musculus psoas major in front of transverse processes. So branches of this plexus goes pierced musculus psoas and goes laterally. So how to show? Musculus psoas, and this is branches of lumbar plexuses. Okay. Pierced musculus psoas major. What branches? First branch is nervus iliohypogastricus. It goes the same like last intercostal, subcostal, along the lateral wall. It goes between musculus transversus abdominis and musculus obliquus abdominis internus and innervate both muscles. Then it goes to the inguinal ligament and innervate skin above inguinal ligament, above, and lateral region of gluteal, lateral gluteal region. So, yes, lateral here. We already have upper and medial. Now we innervate lateral. Okay? Okay, so 2 muscles, 2 skin. Next.
Medius and minimus muscles. Two muscles.
2 muscle, 2 region of skin.
2 muscles means that medius and
Transverse abdominis and internus obliquus abdominis.
Okay.
Next is after iliohypogastricus, ilioinguinalis. Ilioinguinalis. Looks like ilioinguinalis. Goes to the inguinal ligament and goes inside inguinal ligament. Pass through the inguinal canal. Goes outside on the pubic region and innervates muscles, skin of pubis, above pubic bone, and scrotum or labia majora, men, women. Okay? Ilioinguinalis. Then, next, genitofemoralis. Genitofemoralis has special structure when it goes out of it's not genitofemoralis, but it looks like genitofemoralis. After musculus psoas major, it's give immediately 2 branches, ramus genitalis, ramus femoralis. So if you want to find it, you should find musculus psoas major and then find nerve that gives 2 branches, right after genitofemoralis. No. So, looks like this. Two branches right after musculus psoas major. Ramus genitalis, ramus femoralis. Ramus femoralis passes through the inguinal ligament, inguinal canal, and goes and innervates skin below inguinal ligament, femoralis, for femur. Ramus genitalis goes inside inguinal ligament and innervates membranes of testis and musculus cremaster. Musculus cremaster inside inguinal canal. Part of membrane of testis. Genit femoralis, yes. Next is nervus femoralis cutaneus lateralis. Goes to the spine iliac anterior superior, goes to the lateral surface of femur, and innervates lateral skin of femur, of thigh. Nervus cutaneus femoris lateralis. Next nerve is the biggest nerve of this plexus, nervus femoralis. It goes to the lacuna musculorum. First, below inguinal ligament, lies laterally from vessels. Goes to the thigh, lies in sulcus femoralis, anterior. Then, terminal branch of this nerve lies in the canal, canalis adductorius, goes in front, not to the all thickness of, goes in front to the knee, and goes to the medial surface of lower leg. So, nervus femoralis innervates skin of anterior surface of femur, rami anterioris. Then, muscle branches innervates anterior group of femur and musculus pectineus. Anterior group only two muscles, musculus artorius, musculus quadriceps femoris. And last terminal branch is named nervus saphenus, under skin if translate. Nervus saphenus go and innervates medial surface of lower leg and medial surface of foot. Okay, so where is medial surface? Medial surface of lower leg and medial surface of foot. Okay? Medial surface, skin, not muscle, and medial surface of foot. That was nervus femoralis. And last branch is nervus obturatorius. This looks like nervus obturatorius. So, femoralis and medially nervus obturatorius. It goes to the obturator canal, canalis obturatorius, and goes to the thigh. Gives two terminal branches. One branch is posterior, one is anterior. Posterior, ramus posterior, innervates musculus obturatorius externus, musculus adductor longus, and hip joint. Anterior branch innervates medial group of muscles and skin. Okay. So, on the medial group, we have two muscles that has double innervation. Adductor longus from ramus posterior and ramus anterior, and pectineus from ramus anterior and nervus femoralis. Double innervation. That was lumbar plexus. Now sacral plexus. How to show sacral plexus? Sacral plexus is here, in front of sacrum. It formed by partially anterior branch of 4 lumbar, 5 lumbar, and 4 sacral anterior branches. Anterior branches of 4 sacral spinal nerves. Posterior to the gluteal region skin branches, okay? So anterior branches form sacral plexus, and sacral plexus has short and long branches. Short branches, only 4. First is very easy, muscle branches. Lumbar plexus. Did I say about muscle branches of lumbar plexus? No. So, lumbar plexus has rami muscularis that innervates muscles around it. Musculus psoas major, musculus psoas minor, musculus iliacus, musculus quadratus lumborum behind, and the muscle between transverse processes, musculi intertransversarii lumbalis lateralis. So, sacral plexus, the same, has at first muscle branches. Muscle branches of pelvic region. This is except musculus obturatorius externus, that's outside, obturator nerve innervated. So we have musculus obturatorius internus, musculus piriformis, musculi gemelli superior et inferior, musculus quadratus femoris. And also it innervates muscles of pelvic diaphragm. Musculus levator ani and musculus coccygeus. And skin about it a little bit later. So this is ramen muscularis. Then we have nervus gluteus superior. Gluteus superior goes to the foramen suprapiriforme. Do you remember we have musculus piriformis that close opening, and above and below we have openings. Foramen suprapiriforme, foramen infrapiriforme. So nervus gluteus superior goes to the foramen suprapiriforme and innervates musculi gemelli medium and minimum and musculus tensor fasciae lata. Then nervus gluteus inferior goes to the foramen infrapiriforme and innervates musculus gluteus maximus. Maximum only one. And last is nervus pudendus. Nervus pudendus goes to the foramen infrapiriforme, then goes back using foramen ischiadicum minor to the pelvic region and gives 3 terminal branches. First is rami rectalis inferioris that innervates musculus sphincter ani externus and skin above anus. Then nervi perinei that innervates urogenital diaphragm. These are musculus ischiocavernosus, bulbus spongiosus, transversus perinei superficialis, skin above this diaphragm. And last is nervus dorsalis penis or nervus dorsalis clitoridis that innervates muscles, musculus sphincter uretra externus, and deep muscle, musculus transversus perinei profundus, and skin, penis or clitoris. That was short branches. That were short branches. Now long branches, only 2. First is skin of thigh, behind. Nervus cutaneus femoris posterior, only skin, only on thigh, only posterior part. And last is the biggest nerve of our body, is sciatic nerve, nervus ischiadicus. It goes to the posterior region, both of long branches using foramen infrapiriforme. So, it goes to the posterior, then goes to the fossa poplita and gives 2 terminal branches. Nervus ischiadicus innervate posterior muscles of thigh, semitendinosus, semimembranosus, biceps femoris and poplitus. Terminal branches. So, medial surface, nervus saphenus, okay? Last part of femoral nerve. Fossa poplita, behind knee. There is 2 terminal branches of nervus ischiadicus. First terminal branches goes behind nervus tibialis. It goes between superficial and deep muscles of posterior group. So, Gruber canal, canalis cruropopliteus, goes to the medial malleolus, turn and gives terminal branches. Nervus tibialis innervates posterior group of lower leg, all muscles, and superficial and deep. Also it gives skin branches, nervus cutaneus, sura medialis. But here is a trick. Sura medialis, but innervates posterior skin of lower leg. And cutaneus sura medialis in the future unite with lateral and form sural nerve, nervus suralis, that innervates medial skin of foot and medial skin of first finger. Lateral skin of foot and lateral skin of fifth finger. Medial for saphenus. Okay. Then tibial terminal branches goes to the plantar surface. So name of nerve plantaris. Nervus plantaris medialis, nervus plantaris lateralis. Innervate all muscles and the skin of fingers the same like on the head. So plantaris medialis innervate till 4 and plantaris lateralis innervate last part. Okay? That was the first tibial nerve. Second branch of nervus ischiadicus is nervus peroneus communis. Nervus peroneus communis divided on two, deep and superficial. Deep means from behind go deeply in front. Nervus peroneus profundus. Superficial means behind goes not so deep to the lateral surface. Nervus peroneus superficialis. So, nervus peroneus superficialis innervate lateral group, nervus peroneus profundus innervate anterior group. Then goes to the foot and gives terminal branches. Nervus peroneus superficialis also gives nervus cutaneus sura lateralis. Lateralis innervate lateral surface. And lateralis then unite with medial from posterior surface and form nervus suralis for lateral surface of foot. Superficial and deep go to the dorsal surface of foot and innervate only skin because there is no muscle except one, but one innervates from plantar. So, what about skin? For remembering, all surfaces innervates from superficial and deep goes only here and innervates skin between first and second finger. Okay? To explain what is surface for every nerve. So, only between first and second deep, nervus cutaneus, nervi dorsalis, and all other surface branches of dorsal branches from superficial. Okay? No. Also we have last part is coccygeal. Coccygeal, it's not so big plexus, it gives only skin branches for skin above coccyx. That's all. Now it's end. That was 2 classes because we don't have classes on the next time. You have classes. I won't be here, so I give you all information for final viva. Okay?
When is final?
Next Saturday. So next Saturday you can go here and learn itself if you need it, and of course all other days. After next Saturday we have final viva. Okay?
Can you now CNS, PNS?
And eye and
Eye,
ear.
ear.
Yes. So a little trick for you. How to remember all skin innervation, because usually I ask only shoulder, forearm, leg, thin and lower leg. How to remember? So there is a rule of 3 nerve for forearm. We have first is nervus axillaris, upper lateral, nervus cutaneus, brachii, lateralis, superior. Now we have medial, nervus cutaneus, brachii, medialis from brachial plexus, long branch, and posterior and inferior lateral from radial nerve. Okay, 3 nerve, but radial gives 2 parts, but still 3 nerve.
What about medial regions?
Medial is nervus cutaneus brachii medialis, long branch of brachial plexus.
Okay.
What about forearm? On the forearm, lateral part is nervus musculocutaneus lateral branch. Medial part, long branch, nervus cutaneus antebrachii medialis.
Antebrachial.
Posterior is radial nerve, nervus cutaneus antebrachii posterior. 3 nerve again. Lower leg, 3 nerve. Here is medial surface, nervus saphenus, last terminal branch of nervus femoralis. Lateral surface is nervus cutaneus sura lateralis from peroneus communis. Okay. Posterior, remember a little trick, nervus cutaneus sura medialis from tibial. Okay, 3 nerve. Here, rule is broken, no 3 nerves. So we have 4 surfaces for thigh, and we have 3 more regions on the thigh above upper part. So if you want to explain very clearly innervation of this, you should give me 7 branches. But for simple understanding, you can give me only this region. So Lateral is nervus cutaneus femoris lateralis itself branch. Anterior is rami anterioris from femoral. Medial is give nervus obturatorius. Posterior from sacral plexus nervus cutaneus femoris posterior. Okay.
We need to say only names.
Of course, if you say me nervus cutaneus femoris posterior, you should explain sacral plexus long branch. If you say rami anterioris from femoral nerve, yes. Medial surface obturator, nervus obturatorius, lumbar plexus. Lateral is nervus cutaneus femoris lateralis, lumbar plexus. So, what about viva? I will ask you about musculus pectinus, biceps, maybe one, maybe two muscle on the hand, then muscle on abdomen, muscle on the leg. I can ask not on about thorax, head or neck muscle. So muscle here, muscle leg, muscle of abdomen. What I can skip abdomen because only 3 muscle. Usually 3 muscle. So and leg, arm, and something here. Then I will ask one region for skin innervation. Shoulder, forearm, and leg.
Anyone.
Any, but only one. Then I will give you organ. If I give you organ, thorax or abdominal cavity, you give me sympathetic and parasympathetic innervation. If I ask about lacrimal gland, I already can ask about. So lacrimal gland is part of auxiliary.
Auxiliary structures of eye.
Yes, auxiliary structures of eye. So you already explain me cranial nerves. Yes, so I won't ask you additional. But if organ thoracic, so I ask something about head, eye or ear. Cranial nerves.
So total how many questions, sir? Finals.
5 muscles, 1 skin, 1 organ, and 1 about cranial
No.
nerve.
We have to explain about the nerve.
Ear.
Usually eye and ear.
Eye, ear, cranial nerves, and PNS, PNS all are included.
Yes, eye, ear, autonomic system, and peripheral nervous system.
Cranial
Sir, should we
Yes.
show the pointings in the body, sir?
What do you mean pointing?
In the body.
Okay.
The nose.
muscle,
Should we show the nerves? Muscles which?
This is
Deltoid, yes.
innervation.
Supraclavicular. There are
Axillaris.
two
Axillaris.
two innervations. Supraclavicular.
This is
Bicep.
brach innervation, muscular cutaneus. This is
Sir. Serratus. Serrator.
sartorius innervation, nervus femoralis. Okay. So lower leg. This is gastrocnemius, superficial layer, gastrocnemius. Innervation, nervus tibialis.
Tibialis.
So 4 or 5 muscle. Then skin. So forearm skin innervation. You should give me 3 names with origin. Then organ, for example, spleen or pancreas. You give me sympathetic, parasympathetic innervation. Then about eye or ear. So I can ask musculus sphincter pupillae. You should remember where is it. So this is in
Iris.
iris. And innervation. You should again give me sympathetic and parasympathetic innervation, but now you should use cranial nerves. So when you start explaining me parasympathetic innervation, I already understand. Do you know cranial nerves or not? That's all.
Sir, in organ, just we have to say innervation or all the 4 points.
All
With 4 points, then
of
innervation.
innervation.
Total innervation.
Sir, and I have a question, sir. This one. Nervus cutaneus brachiolateralis.
Cutaneus.
Cutaneus brachiolateralis inferior is innervated by radial nerve,
Yes.
and superior is innervated by axillary nerve.
Yes.
What about middle part?
No medial part.
No
Half.
innervation for that.
Half. Upper and
Exactly.
lower.
Okay, first or second?
Superior.
Superiority inferior.
Yes, and I forgot to say, do you remember we have gluteal region?
Gluteus region.
Nervi cluni superioris, nervi cluni inferioris. That was lumbar posterior and sacral posterior.
Two nerves.
Cluni lateral region, gluteal lateral region, innervates from ilioinguinalis. And inferior, this is part of this nerve. Nervus cutaneus femoris posterior gives branch for inferior. So we also take it.
Total how many nerves in gluteus?
I won't ask it, but here is 4 nerves.
4 nerves.
Yes.
ಅದೇ ಲೆಗ್ ಪಾರ್ಟ್ ಅಂತ.